When people get sick or hurt, they go to the doctor. But who pays for the doctor? And what happens if you die? Who pays for the funeral? You can pay out of your own pocket, but that's super expensive. That is where insurance comes in. In this video, we are going to be talking about health insurance and life insurance. Doctor visits, hospital bills, and ambulances are extremely expensive. That is why health insurance is a thing. There are a couple different ways to get health insurance. If you are over the age of 65, you can qualify for Medicare. Medicare is a federally sponsored health insurance program. Medicaid is another option for certain people, but is instead sponsored by your state government, and as such differs from state to state. Medicaid is a lower cost health insurance that typically covers children, pregnant women, the elderly, people with disabilities, and low-income adults. One of the most common ways to get health insurance is through your employer. Many jobs provide health insurance as a benefit, as a way to pay you less of a salary. These benefits, however, can make up for the smaller salary you will be paid. If you are ineligible for the first three ways, then you can purchase an individual policy for yourself or family. If you're self-employed, there are options for that. If you are a student, there are options for that as well. Different health insurance policies cover different things. Some plans cover dental and vision. If you need new glasses but don't have vision coverage, you may have to pay for it yourself. Most insurance will only cover things that they deem medically necessary. Insurance probably won't cover your nose job or tummy tuck. Preventative care, like physicals, are also covered. This is to help prevent possibly more expensive care in the future. Your insurance company will also require you to go see medical professionals within their medical network. These are people the insurance company work with to get lower prices on treatments and procedures. If a therapist or pediatrician is outside their network, they won't pay. Next, we are going to cover some insurance terms that you need to know, such as premium, deductible, copay, coinsurance, out-of-pocket maximum, and tax credit. A premium is how much your insurance policy actually costs. If it's an individual plan, you will be paying for all of it. If you get it through your employer, you will pay a portion of it and your employer pays the rest. A deductible is an amount of money you will pay out of pocket before the insurance kicks in each year. If you have an annual deductible of $4,000, you will have to keep paying for your medical procedures out of pocket until you spend $4,000 on them. That is when the insurance will kick in. A copay is a fixed amount of money you will pay out of pocket for anything medical related. If you have a $25 copay, you will pay your $25 for a doctor visit and then the insurance will cover the rest. Coinsurance is similar to copay, but it is a percentage of the total cost rather than a flat fee. If your coinsurance is 10% and the doctor appointment is $100, you will be paying $10 out of pocket. An out-of-pocket maximum is the most money you will have to spend each year out of pocket. If your out-of-pocket maximum is $10,000, after you spend that much, you won't have to pay out of your pocket for a copay or coinsurance anymore. Premium tax credits, or PTCs, are tax credits you can get to help lower your premium. Your eligibility for this is dependent on your income level. Life insurance is quite a bit different than health insurance. It is essentially a contract between the insurance company and the policyholder to pay out a sum of money upon the death of the insured person. It can be useful to individuals who have people that rely on them for financial support. It can be a load off your mind knowing that your family will be financially secure for a while after you have passed. Whether you're taking a life insurance policy out on yourself or somebody else, there are certain causes of death that can void your contract and cause you to not get paid. If the insured person dies with debt, debt collectors may come after their bank accounts and assets. However, they cannot touch the money paid out through the insurance policy. That concludes this video on health insurance and life insurance. I hope you learned something and wish you good health.